evening. My name is Tun Darwish, and in this video, I'm going to show you how technology has improved our healthcare system more than you might ever think. There's an old saying that goes, a healthy man on 1,000 things, a sick man only one point. Before the adaptation of technology into our healthcare, the healthcare system were largely based on two things. It is paper records and manual processes. Now, what is the key differences between before and after technology has been implemented into our healthcare system? It includes three main points: record keeping, data and research, and access to care. Before technology, doctors or physicians are highly reliant on paper records to keep track of their patient information. Now, what would this cause? This would lead to harder access to information and sharing of that patient information among other doctors. Thus, this would lead to increased risk of errors. Over, data collection and analysis were mainly done by men. So, this makes it much more slower to collect the data and researching it. Last but not least, people that live in rural or undeserved areas often can't get the treatment they deserve. Sometimes, patients can't get their own access to care in time. Did you know that in 19th century, doctors have their own badge of honor? However, this badge of honor is not something they should be proud of because they are the main reason that patients die. Well, this badge of honor is their own apron. The more blood or bodily fluid that gets stained on that apron symbolize the more that doctor has treated patients. Fortunately, researchers have discovered that those blood and bodily fluid that stuck on the apron causes bacteria to grow and infect the patient on surgery, causing them to die. So how have we developed over the years through these poor practices? Some of the examples are, we have developed new technology called EHRS, or more commonly known as electronic health record. This replaces the paper records that the doctors used in the old times, thus making it more efficient and reducing the chance of error during patient information sharing. Another example of how we have advanced from the old times is we have a technology called artificial intelligence, or more commonly known as AI. How does this technology help us, you say? Well, the data that we have right now is so large. Fortunately, the AI can process that data using a short amount of time. This reduces the cost of labor and increasing the efficiency for us to research that data. Finally, patients who live in rural or undeserved areas can consult their doctor through communication such as video conferencing. This makes it easier for them to get the treatment that they need even if they can't meet their doctor physically. Now, enough of this talk. Let's watch this video of how technology might improve our healthcare system more in the future.
In the decades ahead, healthcare will undergo dramatic transformations. Medicine will become more precise. Value will shape care delivery. Patients will become empowered consumers. And digitalization will transform every facet of healthcare. Patients will have a digital twin, a customized computational model of themselves, enabling Dr. Clive to anticipate illness, guide therapy options, and predict outcomes of procedures. Expanding precision medicine will enable radiologists to make highly specific diagnoses for Stephen without unwarranted variations. AI-powered decision models, fed by vast population health data, will improve diagnostic accuracy. Healthcare will become anticipatory. organized around Paula's medical conditions and available around the clock, transforming care delivery. Multidisciplinary, highly productive care teams structured around patients and their needs will collaboratively deliver the full cycle of care. All interactions with John will become convenient, personalized, and compassionate, improving patient experience. Supported by real-time monitoring and guidance, John will become more empowered and have physical and virtual access to care when and where he needs it. At Siemens Healthineers, we are enabling healthcare providers to increase value, shaping the future of healthcare.
In conclusion, technology has had a significant impact on our healthcare system. Moreover, artificial intelligence and robotics are being used in surgeries and drug development, leading to more precise and less invasive procedures. Overall, technology has greatly improved our healthcare system by making it more effective, efficient, and accessible. That's all from me. Thank you.